Hello, my name is Henk Vezen, pediatrician and founder of a focus clinic called Diabeter in the Netherlands. We take care for almost 3,000 patients with type 1. Among them are 1,800 children and the remainder of 1,200 are adults. As part of our value-based healthcare commitment, we want to give the best possible care in children and adults with type 1. And we want to continue that in the current corona crisis as well. Together with my colleague and co-founder Henk-Jan Aanstoot, we will show you some of the changes we have made and some of the challenges we have gone through to make this a success and continue the use of remote data in our care provision.
After the diagnosis of COVID-19 in the first patient in this country, and with the experience of China and Italy already in our mind, we created a Diabeter Corona Crisis Team. As diabetes is treated with high-tech and high-touch, we realized that the latter could suffer in some ways, but that the high-tech created possibilities to continue our care as usual. As from March 9, 1 week later, we were able to have our staff of almost 90 people working from home and do their consultation in that way. Planned consultations were mainly done through phone, although we have some availability of video conference. We even use Skype for that, but we also went to a new program that we use for our video consultations.
Besides this working from home, we kept the core staff of each of the 5 locations consisting of 1 physician, 1 diabetes nurse and 1 assistant. This allowed to continue the care if you require face-to-face consultations in case of newly diagnosed or critical medical problems, or in case of blood sampling, which you cannot postpone otherwise. As there are, of course, many questions concerning the corona crisis, considering the health and the risk in type 1 patients, we built a frequently asked question list for our website. We started with Facebook live streaming on the internet to give enough information, and those sessions were open for live questions from patients. And this all provided in a good information stream towards the patients and reduced unnecessary telephone calls to our team.
Our clinic has not only consultations, but large numbers of e-health consults, including uploads from various devices. This simply continued from the home locations of our staff. We also have a daily open phone consultation in each location, but these were all centralized and questions were dispatched through the entire team of the staff who were working at home. For the in-between conversations between doctors, nurses and other healthcare providers, we used app groups like the protected silo format, WhatsApp, videos or just the phone.
All the medical information is available at home, safely, from the EMR, and this helps in advising the patients. But moreover, it's very helpful for patients to do video conferencing. It reduces anxiety and it improves the communication, especially in case of newly diagnosed or those who have recently started a new device. It is very helpful to have the video conferencing together with the real up-to-date glucose and pump data. We also, together with Medtronic, started video conferencing and explaining new devices and new pumps, and give the whole introduction in pieces in a kind of video conferencing sessions and ready-made video films. This helps greatly the learning, and it's amazing what you can do remote where you otherwise would have face-to-face consultations.
In our clinics, it is standard for the teams to start their clinics with a so-called pre-flight. Patients and all the available data are briefly discussed, and the different tasks and subjects to discuss are distributed in the team. This is even now more important as it reduces the need for the patients to see all the members of the team in the same consultation. After these preparations, including the review and the discussions of the uploads of glucose and insulin and the other data presented in dashboards, we start the consultations. When a phone or video consult starts, we have some standard issues to start with. These items are checking the audio, can you hear me? Checking the video, if the video is okay. Confirm the patient's identity. We usually do that by asking name and birth date. And check if the patient has privacy around him or her and can talk freely. There also, of course, we start with some general questions like how are you doing, how is the situation right now in your family, etc.
What works nice for many patients over the years and where we achieved much more patients than target was to share the data. We use for that purpose a heat map, a color-coded heat map on the blood sugar values. We see it on our dossier, but the patient has it also available on his iPhone. And with this, the patient can continuously monitor how it flows with the blood sugars. We do this now for more than 10 years, and we achieve approximately 50% of patients in target HbA1c. This we now continue, of course, with the remote care. And this is very helpful for the patients to continue this. And we observe the glucose metrics by a system which we call cloud care. So even if there is no communication, we are watchful to see changes, unwanted changes to too many high blood sugars in the patients, too many low blood sugars. And we do this in a computerized way. And in this way, we monitor about 3,000 patients, more or less continuously.
Going through the dashboards, we will answer the questions of the patients as well as from our team, and we will come to conclusions, plans and new settings for the pump or the pen doses and write it down in our EMR, and from the EMR we will immediately mail this to the patient, so the patient also has the plan and the discussion items with him or her. And these steps are only completed when we have made a new appointment. When we call or we video call the patient, it's important to realize that you are not at the desk and that our staff has to make an appointment in another way.
Yeah, we are now for almost 3 weeks in what we call the Netherlands, the intelligent lockdown. We can continue. It is a matter of get the data and carry on. We have a few, let's say, remarks to make. It's very helpful if your staff at home makes a team how they work and take care for the children at home, that they don't focus on the news the whole day and keep safe, that they maintain other communication within the team, so there is no spread in used habits, but there is a shared common ground maintained how to treat the patients well. And take care for the devices. Use the right programs. And my last advice is be aware there is a new program coming up from Abbott for the Libre 2. It will be placed on the reader as an update, but don't do it. You will lose the connectivity with Diabeter, and therefore you can't see the patient's data anymore. So don't use the update. Be very careful.